Dr. Mariaskin, thank you so much for joining us on the You're Not Alone podcast today. I'm super excited to have you on, and I have to say, thank you for giving me like the way to pronounce your last name. Mariaskin is going to just stick in my head so much. So I'm sure that my listeners are like, oh, it's like Mary asking a question. That was super helpful. And I'll tell you, in prep for this episode, I was doing some research on you, and as soon as I saw the title of your book, I was like, yes, I want to know more. So I went to Amazon, and then I saw the subtitle, How to Keep Obsessions and Compulsions from Sabotaging Love, Friendship, and Family Connections. And I was like, this is the topic for our discussion today, because I've been getting DMs from individuals that are wondering how to navigate their relationships while living with OCD. So I want to pass it off to you, and I'm curious, how do you keep obsessions and compulsions from sabotaging love, friendships, and family connections? Where do you start in that journey?
Well, first of all, thanks for having me. And secondly, the audio book version of the book just came out. And so if we have 6 hours and 30 minutes, I think I can just read the whole book and then we should be good to go. But instead of that, I'll just start by saying, I start a lot of these conversations by talking about how even though OCD is an individual disorder, right, it affects, it is diagnosed by looking at symptoms and behavioral patterns, thinking patterns, et cetera, in one person. The way in which OCD can infiltrate relationships and make it scarier to be in relationships, or have, compulsive behavior affect relationships, things like that. All of that is just something that I find myself talking to clients about over and over again. And so I think a place to start, and the place that I sort of start at in the book, is this foundation of trying to help eliminate or reduce the contributions of shame that sort of get in the way at the front end of relationships. So that's kind of where I start in the book, is this idea about how sometimes for people with OCD, and I'm somebody who treats OCD and also has experience with it, personally, that it can feel like you deserve less relationally, or that it can feel like it is a chore for people to, have to sort of deal with you relationally. So that's kind of where I like to start, is self-compassion, reducing shame, and just really building people up to realize that they, just as much as everybody else, deserve to have close, intimate, and trusting connections.
Yeah, and I relate to that, because I think for me, I have the whole reason why I'm on this path and why I do what I do is because of the onset of OCD back in 2016. And for me, it was, and it's just like for everybody, I feel at the start of their journey, they're like, what the hell is going on with my brain? And I felt so ashamed. I felt guilty. I felt embarrassed. I also didn't really know how to tell the people that I cared about. Like, I think back to my relationship with my now wife. She met me at a very interesting time in my life. She met me right when I was starting to experience the onset of these thoughts. And I remembered reading online, because the first genre of thoughts I had was SO OCD, so sexual orientation OCD. And I remembered reading online, like, people that had said, I opened up to my partner about my sexually intrusive thoughts, my doubts around my sexuality, and they like broke up with me on the spot. Like, they didn't understand. And I was so scared of that happening to me. And so I feel like I tried to keep it in for a really long time. You mentioned self-compassion and self-love and overcoming that shame. Where do you start in that process?
Yeah, great question. I don't think there's necessarily it's not going to be a step-by-step process for everyone. I think there's some variability there. But in the self-compassion literature, there are really 3 components that go together to comprise self-compassion, one of which is called Common Humanity. And this is the idea that it's the we're all in this together idea, which again, if you have something like OCD that is only experienced by maybe 2% of the population, and some of them don't even know it, right?
Right.
It's really hard to see those mirrors of yourself in the world. So I talk in the book about how so many people are seeing this like incredibly distorted mirror held up to them in terms of the depictions of OCD that we see in popular media. And so it can feel really lonely to say, yeah, I have SOOCD symptoms. And like, I'm not really seeing that depicted anywhere. So I think a lot of times for people with OCD, if they don't already have community, and I think if there are people with OCD listening to this podcast right now, this is a self-compassionate act because you are connecting yourself with a common humanity of not being the only one who experiences this particular type of suffering. And even to go sort of a layer deeper than that, self-compassion is about how we all experience, pain and suffering on some level. So that's one component of self-compassion. And then another one is sort of like what most of us think about when we think about self-compassion is this idea of self-kindness. So treating yourself like you would a good friend, or giving yourself the benefit of the doubt. And OCD can very quickly wreak havoc on this with all different kinds of symptoms. But say, for example, with harm OCD symptoms, you may not want to get close to people, not only because you feel ashamed, but because you feel like you're dangerous or you're a liability or something like that. So cultivating that sense of self-kindness, positive self-talk can be really difficult to do. And then the last component, which arguably is really like the first component or the foundational component, is this idea of mindfulness, of just sort of noticing things as they are without judgment, and without building kind of a narrative around what it means. So the idea between I experience these thoughts and they're uncomfortable versus I experience these thoughts and it means I'm not worthy of love, or I'm dangerous, or I'm weird, or I'm broken, or etc. So those would be the components. And I guess the cool thing is you kind of start anywhere there and explore those three components in whatever way, makes sense with you and your interests and your personality.
Yeah, the shared humanity piece is really, really interesting to me. I'm actually going to pull this post up on Instagram because I follow this guy. I'm not going to say his name. He's ex-military. He's got a personal brand. He's pretty well followed on Instagram, and he posted, when was 17 hours ago, that it was like this carousel post, and it was two different examples. It was basically like this one guy got caught raping two girls ages approximately 4 and 8, and this person was sentenced to jail. Then you flip over and it goes, two men raped and killed a 12-year-old girl in Somalia and were publicly executed by a firing squad chosen by the girl's father. And in the captions, he basically says, A or B, which one do you think is like more just? Clearly leaning towards like B as the option. For me, looking at it through an OCD lens and shared humanity, I've had guests on all the time that they struggle with harm OCD. They struggle with like intrusive thoughts about like, did I just harm this woman? Was it consensual? Like those types of intrusive thoughts. We have others that struggle with pedophilia OCD. And while I, of course, do not advocate for sexual assault or any of that behavior at all, it does bring into question, when I saw this post, the shared humanity aspect. And as human beings, do we just short circuit right to the most extreme of like, this person did something horrible, so we are going to do the most horrible thing back to them? Because I went into the comment section and it was like, forget a firing squad, give me like 48 hours with this person in like a locked room. And it was interesting. And I'm just curious, from a shared humanity standpoint, how how do you see somebody with OCD navigating things like this that are floating out on the internet, where that would definitely trigger somebody who is struggling? Because that isn't the genre that I struggle with often, but even for me, it was like, whoa, because I've struggled with pedophilia OCD. So even for me, I was like, whoa, that can be quite triggering. What are your thoughts on that?
Yeah, that's a great question. And as you were talking, I was thinking about that, how incredibly triggering that would be for so many people to see.
Right.
I think that this thing can happen with OCD where it feels like, because the thoughts that come up feel, can be associated with bodily responses that are unwanted, or can conjure up a fear about what if that's me, or what if I could do that, that the sort of distance between the what if universe and the what's actually happening universe sort of converge, right? So that
Yes.
you're experiencing the world as if you are the very thing that you abhor and you don't want to be. So I would say, like, in that case, for people with OCD to take a step back and really, consider if they're feeling like, okay, that's me, and so people would want to kill me and I deserve to die or something. If that's the thought process, then taking a step back and really thinking about, like, when we talk about common humanity, we're talking about people who are suffering in the same way that you are, or are dealing with the same things that you are. So really would emphasize that. I don't know. I mean, that post is not about you. And the fact that you're having that kind of reaction is, makes it all the more important that you're kind of surrounding yourself with people who do understand OCD. Now, I think something that I've seen that's, unfortunately, I think even harder to navigate is that people in the public sphere who have talked about things like POCD or harm OCD have been conflated with, people who really do want to harm others, or who are, have sexual feelings toward children, that kind of thing. And I can see how that is incredibly triggering. But I think as a community, again, I know something like that happened. I think it was maybe mid last year, something like that. And we all really just rallied around and we were like, hey, let's use this as an opportunity to educate about OCD. So I don't know if I wiggled away from the topic a little bit there, but that's kind of what my response would be.
Yeah, no, I think that is a helpful response, because that, looking at it through the lens of OCD, I felt like that is quickly where people who have OCD, if they saw that post, that is exactly where their brain would go. And for me, I think a few years ago, that post would have made me sick to my stomach, curled in a ball, crying at some point, not able to separate myself from that type of content. And the reaction, because that's where my brain went, my brain went to, I'm a monster, I'm unlovable, I should die, this is a horrible act, I should die. And that's exactly where he took that post. And I just feel like, even in that post, while I understand that those acts, I don't align with those acts, there's a complete and total lack of compassion, generally speaking, in that post. And so I think, in addition to the shared humanity that you're talking about inside of the OCD community, I also think that it's worth noting that I think that there are a lot of things in terms of shared humanity and compassion, two themes that you've brought up during this conversation already, that the general population could benefit from discussing. I think when you live with OCD, you have to examine thoughts, or at least sit with thoughts, right? We're taught not to examine them, of course, and there is no deeper meaning and nothing more that we need to find out or discover. But we are forced to sit with thoughts that we don't necessarily want. And I do feel that there's a large portion of the population that, I don't want to say, I don't know what the word is. It's like, thoughts need to be pure. They need to be like, you need to think good, positive thoughts. And it's like, well, no, that's not how the brain works. And people think all sorts of things. Obviously, I don't condone acts like that, but can we start to broaden and expand our definition of humanity and compassion, and how we deal with different challenges that we face in the world. So that was something I just wanted to get your opinion on, because I didn't expect me to go down this path, but when you talked about shared humanity, that's immediately what came to mind, because these posts are, I mean, social media, these types of posts are floating everywhere. And it can be really triggering, and it gets to the core of relationships too.
I think so too. I think that right now, I don't know if it's now more than ever. It feels like I've been saying that for a number of years now, but it does feel like perhaps, and not to, reveal myself as being in my 40s, but like, I do think that perhaps because of the way that social media and sound bites work and all that stuff, it feels like many people want to take shortcuts to get a real emotional reaction. And so therefore there are a lot of these shortcuts lead to conveying things in sort of an all or nothing manner. So
Right.
I would say, just in terms of us taking a step back, sort of like seeing common humanity, slowing down, I think it's just hard to do with the current media that we have access to. I've many times I've tried to avoid this with the book and the marketing thereof. Like, I've tried to avoid the tropes of like 5 things you can do to just banish OCD, right?
Right.
That being said, I mean, I wish there were 5 things we could do and it would just be like boom, 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 and we're there. But I wonder if there's part of this, like culturally, we're in a place where everything is like quick. We consume it quickly, and we're taking shortcuts, and we're really not taking the time to be like, okay, hey, that's a person. Let me get to know the person. And so I agree with you that I think common humanity, shared humanity, is something that can be helpful just generally as people, not just people with OCD.
I agree. And Brian, one of my favorite quotes is by Brian Stevenson. He's a civil rights attorney down in Alabama. I think it's Birmingham. And he talks, I mean, his whole career has been centered around getting people that were wrongly convicted out of jails in the South, essentially. And he says that nobody is as bad as the worst thing that they've ever done. And what I love about him is one of his stories talks about a black male Vietnam veteran, served for this country, came back with severe PTSD, and ended up setting off a bomb in the front yard of his next door neighbor, and ended up killing somebody. And what I liked about the story, but what I appreciated about the story was that Brian saw nuance, which is what you're talking about, which was that this man, he did something that I'm sure that every single day he wishes he could take back. But when he did that act, he was struggling with PTSD. He was struggling with symptoms that, especially during that time period, just wasn't being talked about and diagnosed. And that quote really helped me, and that story really helped me, because I was struggling with so many different thoughts when I first stumbled across that quote. And it just made me realize that a human being, there's so many parts to a human, and we're so complex. And to your point, because we live in such a fast society, I think we just short circuit to, we don't have time to think about this. We don't want to think about nuance. We don't want to try to understand the complexities of another person. It's just easier to cut right to like, they're good or they're bad. Now, granted, I know we're getting a little off topic. OCD is, the thoughts that you're having don't define you, and that's a huge part of what I talk about. But I do think it's worth mentioning that all of life is a big area of gray. And I do know people with OCD that, for example, have gotten in a fender bender or some sort of car accident, and then they have intrusive thoughts moving forward about hitting somebody. So it's like hitting somebody with their car. So it's like there was something that happened in their life that sort of triggered that, and now they have that fear.
Right.
Does that make them a horrible person? I would argue no. Like, I want to know the nuances.
Yeah. And I think that you're bringing up a really good point about intentionality and OCD, right? So I think like with a lot of people who have past event OCD or real event OCD, I've heard a number of different names for it. there can be these situations where either, like a really common one is kids playing around and there's some kind of sexual play that happens, which is actually quite common between kids. And of course, can there be, assault as well? Yes, there can. But I'm sort of talking about, those things like it's a fender bender that is unintentional, or it's childhood sexual play. These kinds of things, which are then sort of absorbed by the OCD as quote unquote evidence of some sort of intention or some sort of deeper moral character. And when you said earlier that, we don't examine the thoughts, we don't ascribe any meaning to them, I would say with that, when I'm working with clients, I would say kind of yes and no. So the meaning that I think can be ascribed to it is it's really scary to you and it's really what you don't want to be. So it's almost like the opposite meaning, right? Which I think is kind of what you were saying too. Yeah. But yeah, I think that idea of intentionality, and of course OCD likes to argue back about that, but I think it's awesome. Is that in Just Mercy, that quote?
Yeah. It's a great book. And
excellent
then,
book.
excellent book. You've read it?
I have read it, and I was going to say, like, that is, to me, that's just awesome. That I hope that everybody with any kind of, I hope that we can all read books regardless of whether or not they could also be triggering, right? Like that's my hope for people with OCD, because, like if that's an interest. And so anyway, I just wanted to say that I think that for a lot of people who might be in therapy or might not be in therapy because it feels better to maybe like, I just don't kind of want to go there. Think about the things like the movies and the political movements and the books and things like that you don't have access to if avoidance is kind of in the driver's seat.
100%. That's been a big rule of mine. I had a guy on the podcast who was sexually abused as a child, which was a massive triggering podcast for me. And then he sent me his book and he goes into detail, and I read the whole thing because I was like, this is just one big exposure, and I'm not going to turn away from this. It is interesting what you brought up about the meaning too. One thing that I think's been helpful for me is taking a stance that these thoughts are just junk thoughts and that they don't add any value to my life. And oftentimes, like if I have a thought that's like, you're gay, I identify as straight. So if I have a thought that's like, you're gay, or you've changed sexualities, or you're a pedophile, I agree with them. And I say, yeah, you're absolutely right. Like, you're totally right. This is going to happen. It's the switch has been made. It's just a matter of time before something goes down, I guess you could say. And I try to avoid saying things like, I wish I wasn't having these thoughts, or like, this is horrible. This isn't who I am. And I've found that has really helped me break free from the OCD cycle that I used to get stuck in. Do you see that as a helpful tactic for some of your clients, or how does that work?
Yeah, I do. And I think there are a number of things that can be helpful, because it's kind of like when you're saying, yep, that's going to happen. There is or I assume that there is an acknowledgement that it's a sort of way to embrace uncertainty and say, like, sure, it's coming, but it's kind of irreverent, right? Like, it's in a way, it's sort of dismissing them the same way as, if we see a lot of little kids here in the office here, and if a little kid just ran up and was like, I'm going to turn into an alligator, rawr, you might say, like, yeah, you are. You're such a gator. And it's like,
yes, I like that example.
Bit of a way that you're saying yes, or you're sort of agreeing with it. But I think there's like, it's one foot in the door of, okay, there's uncertainty that could happen. And then also there's sort of that realization of like, and I'm not really going to give you the time of day because, I'm doing this other thing. So, and what's really interesting to me is there are like different strategies that work for different people. So I think after that initial psychoeducation of, hey, usually OCD is attacking things that are, they're ego dystonic, that are not things that you want. And so if we can get like a good sense of like, if somebody comes in and they're like, I'm 90% sure that I am a terrible person, I'm not going to do an exposure and say, you might be. I'm going to say, hey, wait, let's press pause. Let's have some self-compassion. Let's learn about what OCD is. And then whatever's left over in terms of that little bit of uncertainty that feels like it's really hard to get rid of, if we've kind of, done some of the psychoeducation, we've done some logic, I will say to people, can you be sort of sure enough that you can take the leap of saying, hey, I'm going to do the stuff that matters anyway, because I know that there's a possibility, and probably a big one by the end of treatment. But even just knowing there's a possibility that things could be fine, that's kind of more my approach. Yeah.
I like that approach a lot. And I think that is a great way to get people even to like start to warm up to living in uncertainty, because I think that it's a muscle that you build over time for sure, with repetition. Yeah. So we talked about shared humanity. We went and got off on a little tangent there, but I think that was important for people to hear. You talked about mindfulness as well. What was the middle tool that you talked about? It was shared humanity, something, and then mindfulness. I can't remember what the middle one was.
Mm-hmm. Yeah, self-kindness. So that's self-kindness. Just like treating yourself as you would a friend. And most of us are way harder on ourselves than we are on others, or at least with OCD, I see a lot of that.
How do you teach people to become more kind to themselves?
I think there are a number of ways, some of which are sort of experiential, in terms of like, maybe I will, as a therapist, take on the, further along in treatment, I might take on the judgmental voice of OCD and have them kind of like argue with me, or vice versa, right? Like we can do it either way. They can kind of talk about, well, I shouldn't go there. I'm disgusting. I shouldn't even go close to a playground. And then I'm sort of the more compassionate voice, or vice versa. Really saying like, especially if they have friends with OCD or family members with OCD, well, would you ever say what you said to yourself to this other person? Is another way to do it. Sometimes having sort of compassion for yourself if you've had a highly emotional moment, and then afterwards, be it weeks later or years later, I ask people if they would, if you were to sit down with that person from a week ago, what would you say to yourself now? So those are some of the ways to just kind of, cultivate that self-kindness. And I think mindfulness is related to it in the sense that mindfulness, again, sort of strips things down to just the bones of what is versus what things could be or what if. And in that, instead of saying, I'm a terrible person, saying I'm a person who's suffering right now, and I can have compassion for that without the meaning making of I'm dangerous or anything like that, if that makes sense.
Yeah, that does. How do you become more mindful? Because I think that gets thrown around a lot as a buzzword, but I really want people listening to like be able to take something tangible away and be like, okay, I'm going to work on being more mindful with how I talk to myself, with how I interact with my intrusive thoughts. Can you kind of break that down?
Yeah. I think a great way to begin with mindfulness is to there's so many different ways. So I guess one of the kind of, again, a little bit more reverent things that I like to do when I'm working with groups and we talk about mindfulness is, so basically definition of mindfulness is paying attention to the present moment actively on purpose without judgment. So it's not a passive, it's not a relaxation. I'm just passively trying to go to sleep. It's active, it's non-judgmental, and it's present focused. One of the things that I really like to do that I think is kind of a fun activity for teaching mindfulness skills is, and in groups, I'll like print out a picture of a person who I know is divisive, be it like a political figure, or if I'm working with teenagers, sometimes it's like a pop singer or something like that. And there are usually some people who you can find pictures of folks who are just, people love them or hate them. And then what I do is we'll all go around and we will describe the picture in neutral terms. So it might be like this person has brown eyes and is wearing a mustard cardigan or something like that. And to notice that inclination to go into, for example, well, that person has a nasty smirk, right? There's a judgment in there. and smirk sort of denotes, that there's a story that we're telling. So that's kind of one thing to do. Or even just, picking up an object physically. And this is I guess this would be the describe skill for DBT or dialectic behavior therapy. So I'm holding this hair clip, just sort of like narrating what I see without, again, any judgment, anything about positive, negative, just a description. I think those can be some really concrete and like easy sort of bite-sized ways to practice mindfulness.
How could somebody do that with their thoughts? I like that, using like an object outside of them. How could somebody do that same practice with their, like, sitting with those thoughts and having that neutral approach?
Yeah, there is. And I purposely sort of went to external stimuli instead of internal stimuli first, because I do think it's easier for us to be objective as humans about things external to our own, mental experience. There is a really cool technique in acceptance and commitment therapy called cubbyholing. And this is a technique where it's good to do it with somebody else. So even though it's based on thoughts that you're having, you can do it sort of sitting across from somebody else. I like to do this as well in groups. And when you have a thought, you say aloud if it's a statement, a judgment, an urge, or a sensation. So I guess it's any internal experience. What we're doing by cubbyholing that I think is really neat is you're divorcing the thoughts from their content, and you're just sort of labeling them as they are. You're putting them in little cubby holes in your mind, right? Like that's a statement, there's a judgment, there's a sensation, urge, sensation. And it's kind of funny too in group, because you'll have two people just like saying these words back and forth to one another. I like it because it's showing that we're really interested in not the content. Again, we're not going into the story, but we're just sort of labeling what's arising. So I like that. I sort of like that more than the kind of like, imagine your thoughts as leaves on a stream, which is sort of a classic internal mindfulness meditation, or technique, I should say. It resonates with some people too, but I really like cubbyholing, perhaps because I'm more of a like verbal person.
Yeah, I've never heard of cubbyholing before, and I think that it sounds like such a useful tool. And it does build so much awareness just around what bubbles up in the brain without, to your point, putting some sort of this is good, this is bad label. It's more of just this is what it is, and it's just this is what this is bubbling up. This is what this is bubbling up, versus why is this bubbling up? Why is this happening? Oh, that was a good thought. That was a bad thought. So I think that is a really, really useful exercise. I'm really glad that you shared that.
Yeah.
One question that I had for you around relationships is, how does someone struggling with OCD go about navigating a romantic relationship with their partner when they don't want them to know what they're struggling with?
Yeah, it's a great question. And I want to acknowledge that with romantic relationships, I think there are so many different types of romantic relationships available to people. So I don't want to make any assumptions about the level of, emotional intimacy that is desired in the relationship. That being said, I think for many people, so there can be, people can be casual or friends with benefits or, polyamorous or all that kind of stuff. And there's no judgment there. I think in some ways, and again, I get polyamory you can have very close relationships in that context as well. But I suppose that for more casual relationships where that level of emotional intimacy is not as important, perhaps, there I would say, thinking about the ways in which one's OCD is going to arise within the relationship and potentially be misinterpreted by the other person. Because I think a lot of times if something like sex or intimacy or, even just doing certain activities is complicated by having OCD, the last thing that I would want is for a partner to misinterpret that as, rejection or as to attribute it to something other than OCD. So I would say that's one way where that's one circumstance in which you might want to say, okay, you know what, I probably should disclose. In terms of disclosure in closer relationships, I tell people that, like, again, I think you deserve to be in a relationship with somebody who's going to know you and know you, inside and out. That doesn't mean that there's a mandate to disclose to every potential partner that you have OCD, but that process of disclosure, I think, is sometimes is guided by things like, okay, well, how is my behavior going to be misinterpreted? Has this person demonstrated to me that they're trustworthy in other ways and that they're sensitive in other ways? And then I say in the book that disclosure isn't exposure, because you really can't control necessarily the other person's reaction. So I feel like, Zach, you kind of asked me, how do you go about a relationship without disclosing it? And I was like, well, here's how you do it with disclosure. Because I think it ends up being that so much of the time.
And I agree with you. I mean, I think that is foundational to a healthy relationship, is like, you have to be your true, fullest, authentic self. And living with OCD, I feel like, and not telling a romantic partner, that is a big part of I like to say, it's not, OCD is not all of who we are, but it's a part of us, and it's something that we have to learn how to cope with. And we learn a new set of skills and a new mindset and a new way of living and navigating our brains. And it's just like, I wouldn't want a partner to not be a part of that with me. So then I guess let me ask this question, because basically what we've said is, don't recommend not telling a romantic partner that you're struggling. If you're in the shoes of somebody who's struggling and they haven't had that initial conversation, how would you go about that? And is there anything that you recommend people do mentally to prepare in case that person doesn't respond favorably?
Well, I'm actually going to start with the second question, because it's a tricky one. When you have OCD, if you tell people to mentally prepare for something, that can sometimes be like, well, okay, so I've ruminated about it for like 2 days. Is that enough? So I would say part of flying in the face of anxiety is doing less preparation than you probably feel like you need. That's a blanket statement, right? So if you tend toward more impulsivity, maybe I'd say, yeah, let's take a step back and think about the risks and how can you kind of take care of yourself. That being said, I would probably generally say, hey, just going into this with the intention of being true and honest and being open to what happens, as opposed to sort of like prepping for it. But again, that's going to change individual to individual. And of course, like you said, if this is somebody who's newer to relationships or is the first time that they're disclosing, I think we probably would do some kind of, prep work in the sense of, how can you support yourself if things are not well received. Now, that being said, to kind of go back to how to disclose, again, it's important that it feels like it is, that you're giving yourself sort of like consent to do it, right? That it's not something that feels forced, or you're not doing it because like you heard this podcast and you're like, I have to tell a partner. That being said, I would say there are a lot of options of, what you disclose and when you disclose. Some people don't even want to start by using the term OCD. They might say, I have anxiety. Or they might say, I have OCD. I'm not ready to talk about the specific content area, but I want to over time. Or they might even start it out by saying, what do you know about OCD? And sort of seeing where the other person's understanding is and how to kind of meet them there. So I think there are a lot of different ways to do it without feeling like you have to, disclose everything all at once. And sort of open yourself up that way.
You can sort of take it in a tiered approach if that's what you're comfortable with. Do you recommend that people send, like, prior to the first conversation, sending links to a loved one to say, hey, I'm going to have a conversation with you later. It would be important to me if you read this beforehand. I guess, what are your thoughts on that? And how much does the person who's struggling with OCD need to do research to then be able to explain what's going on?
Those are great questions. I certainly don't, as a matter of course, say, okay, for anybody who's disclosing, definitely send materials ahead of time. I think if that's somebody's kind of inclination and the way they like to communicate, I think that's great. There are some wonderful books out there. In addition to, I think mine would be useful for family members as well. But there's Loving Someone with OCD or When a Loved One Has OCD. I think those are two titles that are out there that are great. Oftentimes that ends up becoming sort of a secondary conversation of, hey, I want to tell you a little bit about OCD. I would, if you want to learn more, I have some resources for you. I've had plenty of people, again, another impetus for writing the book is I've had plenty of clients who will bring their spouses, significant others, family members into sessions. And I love doing that kind of education as a group. And then in terms of like how much should the person know about OCD before they disclose, I always think it's helpful because it's helpful to know like, okay, here's what it is, here's what it isn't, and here's what I'm working toward, like here's how I manage it. That being said, again, I don't think there's any imperative to kind of do a bunch of research because I don't want for anybody to feel like they just have to be like a sole educator. That can be really draining. So saying, hey, this is my experience. You want to learn more, you can get this book or we can talk more. I like that flexibility.
Yeah. The one thing that comes to mind, and then I know for timing's sake, I'll get you on your way. For me, I was super depressed and anxious when I first told my wife. She was my girlfriend at the time. We hadn't been dating for that long. The emotional toll that I was afraid that would take on me, in addition to what I was already struggling with, was really scary. So do you have any thoughts, like, is there, if somebody's like in a really dark spot, in a really tough spot, like, is that one of those conversations that they should put on pause until they start to feel better? Is it better to know early on whether that person can go on the journey with you or not? I guess, what are your thoughts there?
Great question. I might go to what are the reasons for moving forward and the things that are holding you back? So again, in acceptance and commitment therapy, we might call these like approach and avoidance moves. So if the impetus for not having the conversation is avoiding, that this may not go well, I would really want to look at that and say, okay, is that aligned with what you really want in a partner, right? If you want a partner who really knows you at your worst, knows you at your best. And maybe it is. Maybe it's like, yeah, I want somebody to know me at my best, but I've also, I haven't known them that long. And I don't feel like we have the kind of relationship now where I want to delve into that. I think so you were asking kind of like if somebody's really, really down, do they wait? Do they not? Yeah. Okay.
Yeah.
It's coming back to me. And then sort of like, what are the approach moves? Is there a way in which that conversation can be liberating? If we think about shame as something that lives in the darkness, something that sort of thrives on keeping secrets and so forth, if you're even if your intention is I'm just not ready to tell, if your brain doesn't know the difference, if you're like sort of keeping a secret, it can still feel like it's reinforcing that shame. So of course this is kind of individual basis, but there is no right or wrong way. I mean, I would say if that person is in that situation and going to a therapist, that would be a great thing to discuss in therapy and kind of talk about pros and cons and things like that.
Yeah, and I agree with you. It's circumstantial. It depends on a lot of different factors. I just want people to be cautious in terms of not, because OCD can already be overloading. And I just would hate to see someone then put themselves further in the hole because of a situation. But to your point, it really does depend on the circumstances. So I'm seeing the time. I know that you have to run here soon. Before we jump, what is one piece of advice that you would give someone who is right at the start of their OCD journey right now?
I would say one piece of advice.
It's hard.
I think it's really hard. I know it is. I think we know that. I guess I would say, the old adage, comparison is the thief of joy. I would say that that is a really important thing to think about when you have OCD, in the sense that, yes, there are, so I would say there are fantastic treatments available. There's an amazing community. I think people with OCD are just the coolest. Like, I love us. We're amazing.
I agree.
And there is no need to compare your sort of journey to anybody else's, because they're not going to look the same. And I think sometimes we try to get solace in seeing, okay, I know somebody, they went through 12 sessions and they had this great turnaround, which is very, 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 very rare. But of course, sometimes we're going to have access to those kinds of stories, or highly negative stories, or this type of therapy worked best for this person. The cool thing is we do have sort of multiple, they're all under the CBT umbrella, but we have multiple best practices or we have multiple treatments now for OCD. So if you want to do sort of more of an ACT or more of an ERP lens, so that's what I would say is, be careful with the comparisons. Yes, get your community, but don't sort of compare your progress to anybody else, because I think that can be detrimental.
I agree. And I think that is an excellent piece of advice, because I get that DM a lot. How long did it take you to get to where you're at now? And I'm like, I'll give you the answer, but timelines don't matter, because mine was actually longer. So I'm like, I don't want people to get discouraged by telling them a longer timeline when they want it to be shorter. Or obviously you have the opposite of that. You have the anomalies where they pick it up, it's quick, and they reclaim their lives. So I totally agree. Comparison is the thief of joy. There are so many different routes to recovery. I really appreciate you coming on the podcast today. Where can people connect with you?
Well, I am so they can definitely, get the book. In terms of social media, I do draw mental health comics, just very, very sporadically, but they're at OCD Nashville on Instagram. So that's one place. And we have a clinic here in Nashville. I'm so privileged to have an incredible team of therapists working alongside me here. And our clinic is just ocdnashville.com. So anybody in the state of Tennessee, we do have one provider who can also practice in any of the so-called PSYPACT states. So those are some places. We have groups, we have individual therapy, and I will probably just keep doing a bunch of podcasts, because I really enjoy having these conversations.
Yes, me too. And I'm so grateful you were willing to come on. So thank you so much, Dr. Mariaskin, for gracing us with your expertise and your perspective, and look forward to having you on again, hopefully at some point in the future, because there's definitely more that we need to talk about for sure.
Love it. All right. Thanks, Zach.